recording.
The part that I haven't present yesterday is about Sergio and Natasia. I don't know if I read the words right, so sorry. What is surgical anesthesia? Anesthesia is a surgical procedure that uses drugs to act on the central nervous system to temporarily render a patient unconscious, insensitive, and unresponsive. The main techniques include general anesthesia, via intravenous or inhalation, endotracheal intubation, and the use of a laryngeal mask. You can see this is William T.G. Morton. He was born on 1819 to 1868, so seemed like he died too early. So if he can live longer, he can have more important invented for human life, especially in medical. He is an American dentist who was first to publicly demonstrate the use of inhaled ether as a surgical anesthetic in 1846. The breakthroughs. In 1846, William T. Morton publicly demonstrated the use of ether as an inhaled anesthetic during a surgical procedure. This is the world's first public surgical surgery under anesthesia. It took place on October 16, 1846 at Massachusetts General Hospital in Boston, USA. Anesthesia administered by dentist William T.T. Morton. He is also the one who invented it, and the surgeon is Dr. John Collins Warren, the founder of the hospital. The patient is Mr. Edward Gilbert Abbott, a local printer in that area, and anesthetic use is ethyl gas. Surgical procedure details is to remove a large vascular tumor in the left side of the patient neck. And this is the first public surgical under anesthesia. This history event inserted in a new area for modern medicine, freeing patients from the excruciating pain of surgery. And here I show you some stage of anesthesia. The first one is when we come into the surgery soon, we will get anesthesia. Doctor inject or give patients medication to induce deep sleep, so get them in the surgery. Then they still continue anesthesia. The doctor continue administer the medication to keep the patient asleep and pain-free throughout the surgery. And final is conscious. They stop the medication to allow the body to breathe its own again, like our body work again. Eyes will open after the surgery from 5 to 30 minutes, and full consciousness will be achieved after 24 to 48 hours.
That is all.
Yeah, just one part.
Show the slide again, Sophia. Show that one again. Let's stop it. Okay. I
Oh.
wrote the pronunciation in the chat box, in the group chat, and also on the screen before you. When you stop sharing it, it lost.
Actually, I don't know those kind of words.
And that's why I come to practice. We have to practice before we present. You cannot just say, okay, I'm going to introduce you something that I don't know how to pronounce it. So sorry. Bear with me. No, you had to practice at home first. Okay. Anesthesia. Anesthesia. The th, like thank you. Okay. Thesia. Okay. And contrast. What do you say with contrast? Contrast mean contrast mean is as a state of people staying totally awake understand and fully understand your body or something going on your body. Okay. All right. So we have time for this question. Yesterday there's a lot of question already from to Sophia. So now Sophia, you can choose your friend to ask. I like to talk about this slide that you have said is show today.
Wait me a little bit.
Again, give me some minutes. Wait for me.
Miss Yan, I can log out if I share the screen, so can I stop sharing?
Okay, then I will show you the screen. Okay. Sure. Let me see. I can share the screen.
I think all the questions are like the answers in my presentation. So the first person I chose is John. The question is, where does the word vaccine come from?
John, you're having fun somewhere. Come back to it, John.
What? Don't
Where
understand you're
does
saying.
where
You're being
does the
chosen.
word vaccine come from?
John, did you hear the question?
I'm thinking. I don't know. No idea. But I have a
No,
question.
no,
But I have a
wait,
I
John, you
only have
cannot
questions
say no.
for.
I'm here. This information was introduced by Sophia
I think
yesterday in her
vaccine comes
slide.
from the word vaccine.
Edward Jenner,
I have no idea. I don't know.
are you hearing me now?
Yes, Pa, I
I
heard
don't
you.
know where the word vaccine comes from. I only
You,
have some questions for the presentation.
So anyone remember the presentation of Sophia yesterday when she talked about vaccination? She mentioned the name vaccine. It starts from what?
I don't know.
None of you guys remember Anna? Hermione Granger, who is
I
it?
don't. No, I don't remember the name.
Who's Hermione in this class? Julie? Sleepy bags, Julie.
I have no idea too.
Important.
He mentioned, oh my God, what I was the only one who pay attention to Sophia presentation? She, I remember that she mentioned the vaccine was the vaccine. Start with the beta, with cow in Spanish. And then later on was named by Louis Pasteur on to contribute to the first guy who created vaccine using the word vaccination. Okay?
Yes, but
That,
you explain and list out. Like I have one more information about it.
yeah?
about which vaccine, right? Railway vaccine, right?
No, it is like the word vaccinia also mean the cowpox disease, and at that time, Edward Jenner he injected vaccine to help people who has the disease of cowpox. So then he take that name.
Mm-hmm.
Okay, next question to the next person, Sophia.
Okay.
You can ask all of them, each of them one question. See how much they know and remember.
Next person is Anna. Let me see. Who were the key scientists that demonstrated germ theory?
What?
Who were the key scientists that demonstrated germ theory?
Germ
Do you-
theory.
Let me send you in the chat box.
When you dig into a new area, there's a lot of new vocabulary, and this is a great chance for you guys to practice learning and speaking and writing the new vocabularies. Okay, so Sophia, try to practice over and over again, maybe listening more videos about this medicine.
I don't remember.
Okay, here I have a better question. So Sophia, I asked Sophia to prepare the presentation about some fractures in medicine. How many fractures did she mention, Peter? Peter, anyone remember how many did she mention?
The breakthrough medicine.
That
Um,
Sophia mentioned in her slide. How many?
how many? I remember the breakthrough of vaccine in cowpox. The breakthrough of germ theory, that is Pasteur, right? Koch. Did I mention it right?
Only two?
Uh, and penicillin.
Antibiotic.
Yeah, antibiotic and X-ray.
X-ray.
Yeah. Yeah, and anesthesia. So,
Was it correct, Sophia?
Yes.
Okay, so today we're talking about surgical anesthesia. Anesthesia. Okay. Right now, let's see. Try to think of any kind of surgical or surgery a woman would go through, and they had to use anesthesia.
I don't
Yes.
know about yeah, but X-ray for X-ray, I thought that Marie Curie, she
No, I mean,
discovered
I'm not asking the scientist. I'm asking about people around the world. Normally, women or female had to go
Giving
through this
birth?
giving
Thing
birth.
to
Very
the
good.
baby.
Okay, and how much do you know about that? How do they insert or inject this to the woman body? Do you know?
from the leg down, like our back, then down to our legs.
From
We
your spine, straight to your spine. Oh, they inject directly to your spine from the back, yes, and then it's gonna start to move down to your to the lower part of the body. Okay, one more. A lot of people had to go through this surgery. Not only female but male, but it's not necessary. You have to cut this away, and then if it's not, it may cause you kind of stomach ache. What kind of surgery is that?
I'm quite like mess up. Can you repeat it?
So in our stomach, we have some part that we need to cut away. But to normal people, to other people, they would not having any problem to the rest of their lives. Some people may cut it when they was young or even when they was very old. They had problem with it. Do you know what is that? John, Bean?
What does it say?
I'm talking about the problem having in our stomach. There was
Appendix?
one part,
Appendix?
I don't
appendix,
remember.
yes, exactly.
Out and I needed to
Okay,
cut it.
we had to cut appendix when it's come to extremely pain. Um,
Then
or,
what happens if we leave it there?
well,
Leave
normally
the appendix.
the appendix is the
If
extra
most
part of
people
your
can
stomach.
survive without it, no need the appendix.
We don't know why it's there, but it serves certain job in our body, and then eventually we had to cut it because it caused
My
pain.
mom's appendix, gone.
Okay,
My
now
mom,
not only appendix, what about dental problem? Have you ever been through going to the dentist and you have to put
the canal
any
roots,
very good girl, now you remember. Can I read anything else?
dang. My sister hates brushing her
Tooth
teeth.
decayed.
So that's
Uh,
why
Or tooth surgery.
she may have a chance to do the canal
Yes,
room or
when we
extract
have when
some
we have to
sort
remove
of
the
black
teeth
tooth.
in series, not just one tooth. Okay, and it's called a
Uh,
lot of pain. Right,
Repetits.
Sophia, you want to ask another question?
Wait me a little bit.
There's another.
Would
Hold up,
you
I got a
think
fact.
that
I got a
Sophia?
fact. I got a fact.
The questions
I
are actually very easy.
is
You ask her.
I got a fact.
Like the answers in the
Did you?
slide.
Did somebody say an asshole? I heard that.
And if you want, I can send you the slide so you can have the answer.
No, the point that they remember.
But
Okay,
I got a
so
fact. There's
the
another kind
question.
of a.
Okay,
There's a gas that looks like anesthesia. That feels like anesthesia. It makes us lightheaded. It's called nitrous oxide.
Oh yes, it give us that is another
Often
anesthesia
also
that the
used in
doctor gives to
dentists.
us.
here. I think that this one is a little bit hard, but you don't need to answer it in details. What surgery was performed during the first public demonstration under anesthesia?
Okay, guy, I this is the the vocabulary that so in Sophia's slide. You should write this one down.
Yeah, can you share the question in the chat, please?
I have already sent you.
Uh-huh. Thank you.
Excruciating.
Public news.
That is the
Um,
most painful excruciation.
Oh, interesting. What was that? I don't
um,
remember
Oh
too.
no.
yeah.
Can anesthesia can reduce all the excruciation in your body.
Uh,
I think
I
so.
remember that Martin is the one who discover anesthesia was the breakthrough, right? Oh, you are showing that.
I'm showing already. Okay. Let's discuss about anesthesia because I don't know if you guys have been ever through got through these any procedures that you had to use anesthesia in your life or your family members. Okay, do you know any side effects if you use it during the surgery? It's believed that when you use anesthesia during the surgery, you reduce your pain. What about any side effect? Anything had both side the problem. So do you know any side effect of it? Anna,
What, teacher?
will you understand the question? Fine.
Yeah, you asked that what is the side effect of anesthesia?
Yes.
Mm,
I don't know.
Like is when you are when someone give you anesthesia or after
Any
that,
any time during or after.
maybe after that, your brain maybe lost a bit memories, but then if you talk to your family members or your parents, maybe that will come back and
Um,
like
It is true
um,
that it's causing you a
yeah,
short-term memory problem. You easy to forget things, and also you had
Oh,
more
really?
pain.
I didn't
Yes.
know that.
yeah.
I've
Um,
been surgery 3 times because my teeth are like not normal. So, but I still very no like
your memory
remembering.
still right. Not
Yes.
it's not on it's not on the time, okay, and it depends on the dose, the amount of anesthesia that and the time that they put on the body, how long that it take, and the amount of it gonna affect cause the effect, and also depend on the age and on the health of the patient. For example, the older, the riskier, the weaker, the easier. Okay, so maybe you were young and the amount was not were less and the time was short. Also, there's not I didn't have no strong effect yet, but accumulate you find like you don't find your brain, you would have more some.
Miss here, I think something like some problem happened with your microphone, and sometimes we cannot hear what you are talking about.
Oh, okay. Can you hear now? Probably.
Yeah.
All right, I was saying that the amount of the anesthesia and the time that they take for your body and depend also on your health is causing different effect. Okay, so to different patient have different side effects, but mostly you would have some time you would not be able to remember things. Also, you would have experience small pains in the future in some other part of your bodies. Okay, especially for the women who get birth. Asha, it was I think you would know very well by now. Your mom would easily forget things. They would always leave that thing around, or they would always ask you, "Where's my phone?" or "Where's my things?" It's kind of side
Yeah.
effect, really. Okay, so I think we can stop Sophia here, and we go back to our work. Let's see, do we have time for this? Maybe this one come after. We're gonna do the listening first. What is constellation, Anna?
I haven't heard this word before.
Ah, okay. Julie, have any ideas about constellation? From the picture, you can guess. What is it?
Oh, the stars?
Like
The group
uh,
of stars?
Yes, the group of the stars. So what are the group of the star when we look into the sky in the nighttime and you can see or you can recognize? And what do we know? What do we learn? What do you know? What do we know? And what do people do when they understand and they group different kind of constellation in? Okay,
About
let's
different like constellation that is called some zodiac, right?
yeah,
Um,
that come after. First, you have to understand what's constellation, and then come zodiac sign. Okay, can you read this one for me, please, John?
Constellations. Constellations are recognizable star patterns named and cataloged by astronomers. These patterns are resulted from lines of sight with stars at varying distances. Constellations aid navigation in the night sky, providing a convenient reference for locating celestial objects.
Celestial object. What is celestial objects? What are?
Those, uh, those like Aries, those zodiac signs, the zodiac signs.
Okay, it's not just the zodiac sign. All right, we describe here celestial. Celestial is an adjective to describe um how do I describe this one? It's like something related to the sky, outer space, or the spiritual related to outer space, or the spiritual heavens. Okay, so we can use this one to describe the stars, the planets, and gods, or anything that feel holy can be used to describe because it's an adjective. The stars, planets, gods, or anything that you feel holy, heavenly. Okay, remember it's spiritual. For example, if I say celestial body, mean it's a nature object in the space. It could be a star, it could be a planet. It could be planet or star. If I say celestial sphere, it's an imaginary ball of the sky used to map space. If I say celestial navigation, like finding the direction using the star and the sun. Okay. Let's see. Do you know any kind of constellation in this? Any group of the star name that you know?
Aries.
Aries? Not yet. Too early. Okay, the Orion. Julie,
It's an
could you read
archer.
this? Could you read this one, please?
The Orion constellation is renowned for its trio of alien stars that resemble a belt, distinguishing it a prominent feature of winter night.
Theaters, not feathers. Theaters. Okay,
Teacher, did you know that we can see this constellation in the sky? We
I try, yes. People say that I have never been able to. Oh, I'm not good
Yeah,
at
but
picture.
we
yeah,
just
that's
also
very
could see these three stars, you know.
Really?
Yes, because at in Vietnam the skies are too like uh we often have clouds, so we just see three main that three main
Major
stars.
bright. Okay,
Yeah.
the brightest one in this constellation.
Yeah.
I see. Okay. Well, I tried when I was a child. I think when I read when I was about 7 to 10 years old, I tried to look all the time in the sky. I would not be able to imagine any kind of constellation at all. I
Uh,
mean, all the star
this
looks the same for
constellation
me.
is giving Harry Potter vibes, Loki.
Oh gosh. The easiest and we can see in Vietnam that is Big Dipper one.
Let's see.
Yeah, I
Any
can. I see it with Anna's friend when we are
by
gathered
without
over.
any
Yeah, without any how
telescope.
is it? Yeah,
Telescope.
but
Wow.
just you
The, but the first time when you see them, were you able to recognize its shape, or it just because Anna said, "Ah, look, it." Then you oh yeah, it looked like so.
Yeah, it's well, we'll never have the line to between the stars, but we know because at the we look at the
it looks so easy to look. It's big, but like it's formed the shape and we can see it exactly.
Ah, okay. At least, well, I could not really. I'm not good at very good at art. So when I look at it, I couldn't imagine the shape at all. I just see it in random places, and then okay. Next one, Dean, could you read this one? It's a princess.
Andromeda constellation is char- characterized by a
Characterized.
unique characterized by a unique V shape created by its biggest stars. Its
Brightest.
name, brightest I thought it was biggest brightest stars. Its name is de- derived from the Greek my mythology mythology Princess Andromeda.
Okay. All right. So let's just go through all kind of constellation. I just need you guys to read it up because you guys really have trouble in reading while spelling the vocabulary or even the common vocabulary. So we need to practice reading more. What is derive, John? Peter.
Yeah,
Derive.
what
What
derived?
does that mean?
Uh, Original?
They said derive from